The main aim of anticoagulant therapy is to prevent formation of intravascular thrombus or further extension of the already formed clot. They do not dissolve the clot or thrombus once it is formed. Treatment is initiated with and continued for at least 4 to 5 days. It is usually started simultaneously as it has a delayed onset of action, like deep vein thrombosis and pulmonary embolism. Venous thrombi are mainly formed of fibrin network with a long tail that can easily detach and result in embolization and pulmonary arteries. Anticoagulants are used for the treatment and prevention of thromboembolism. In high-risk cases, prolonged hospitalization, prolonged immobilization, major surgery, major trauma, etc. Next use is myocardial infarction. In case of unstable angina, rheumatic heart disease, and arterial fibrillation. Next use is cerebrovascular diseases. The other use of anticoagulant is vascular surgery, prosthetic heart valves, retina vessel thrombosis, extracorporeal circulation, and hemodialysis. The last but not the least use of anticoagulant is defibrillation syndrome and disseminated intravascular coagulation. At low dose, heparin may be useful to inhibit formation of thrombin therapy, decreasing consumption of clotting factors. Now, fibrinolytics or thrombolytics. What does it mean? Fibrinolytics promote the conversion of plasminogen to plasmin. Plasmin degrades fibrin into fibrin degradation products and thus rapidly dissolve the blood clot. The types of thrombolytic agent are described in this manner. Now, we have to learn what is the uses of fibrinolytics. Administration of fibrinolytic drugs by the intravenous route is indicated in cases of pulmonary embolism with hemodynamic instability. After that, severe deep venous thrombosis such as the superior vena cava syndrome and ascending thrombophlebitis of the iliofemoral vein with severe lower extremity edema. It can be also given intraarterially, especially for peripheral vascular diseases. We can see in the types of thrombolytic agent, streptase, or it is a streptokinase types of fibrinolytic agent, which is a protein derivative from beta hemolytic streptococci. Streptokinase bind with circulating plasminogen to form a complex that activates plasminogen to plasmin. Some Streptokinase is antigenic, pyrogenic, destroyed by circulating anti-streptococcal antibodies. It is generally administered by intravenous route of administration. Some adverse effect of streptokinase is bleeding, hypotension, allergic reaction like fever, chills, skin rashes, and rarely anaphylactic reaction. Some risk factors or risk uh, due to uses of thrombolysis are: thrombolysis may not be recommended for those patients who have in treated or in the treatment with blood thinning medication, herbs, or dietary supplement, or for people with certain condition associated with increased risk for bleeding. These conditions include severe high blood pressure, active bleeding or severe blood loss, hemorrhagic stroke from bleeding in the brain, severe kidney disease, recent surgery. Besides risks of serious internal bleeding, other possible risks include barishing or bleeding at the access site, damage to the blood vessel, migration of the blood clot to another part of vascular system, and kidney damage in patient with diabetes or other pre-existing kidney diseases.